So today I'm presenting a case of a young man in his 40s who is highly educated, who works on Wall Street, extremely successful, has a family, and has gotten a very high level of education, and overall has been very successful and doing well in life. And in the last 2 years has developed a lot of issues with concentration, trouble at work, where he feels that he needs a lot of props in order to complete his work tasks, like little sticky notes to remind him what to do, or his secretary keeping a very tight schedule for him, as he's had a lot of difficulty in remembering what to do in multitasking. Additionally, when he would come home, usually would be extremely energetic, versus now would require a nap at about 6 o'clock in the evening, and would not be able to do a 12-hour workday, instead needed to cut his work hours shorter. He attributed a lot of these issues to being married recently and having a child and having a stressful job, and so kind of sweep this under the rug, which is very typical, what I see from a lot of my young patients, where they'll say, oh, I'm just under a lot of stress, or I'm getting older, or there is a lot going on at home and at work, which is all true, especially since we live in the metropolitan area in New York City. But often when you take history from patients, they will have had all of these stressors and more prior to the onset of their symptoms. So this person went to his primary care doctor, who referred him to a psychiatrist, and he was eventually diagnosed with ADHD, which is a concentration problem, and typically is a condition that is diagnosed in children and young adults, and is found during the time of school years, especially high school and college years, when people have increased workload and increased demand from their schedules. And that's when it's diagnosed with the teachers, the family, and the person themselves noticing that they have issues concentrating and completing certain tasks. And for this problem, usually one is prescribed a stimulant, such as Adderall, modafinil, and others. So this person was diagnosed with some depression and concentration problems, and prescribed an antidepressant as well as a stimulant, and has done somewhat okay. He was able to manage, but still noticed that he's not 100% himself. So over the last 2 years, he's been on these two medications, and kind of things were going up and down. Sometimes he's a little better, sometimes he's a little worse, but continuously took these medicines. He came to me because he kind of wanted to get to the bottom of his symptoms, and we worked him up and with an MRI of the head, an EEG, which is an electroencephalogram, as well as extensive blood work. On this blood work, we did find that he's positive for Lyme disease on his Western blot, including ELISA, where he was positive with over 5 bands. And so I started him with proper treatment with antibiotics for his Lyme disease. And within 2 weeks, he discontinued his stimulant. He started doing extremely well at work. His energy level has improved. He read 2 books in a week, which he hasn't been able to read for leisure for over 2 years because he's had trouble concentrating. So my point with this case is that this person did the right thing, where his diagnosis did not fall into the textbook diagnosis of ADHD, where he presented as an adult. He's never had any issues as a child or young adult, and so he persisted with his doctors and found a cause for this reason, and we're able to take him off his modafinil, which he hasn't been on for 3 weeks and has been doing phenomenally well. Prior to this, as I mentioned, he's been on this medication continuously for 2 years, and now since he started Lyme treatment, he has not needed his medicine for concentration in over 3 weeks. So this is one of the cases that I think is important because people have certain symptoms that come up and they're not sure if it's normal or do they need to pursue this further, especially if one lives in an endemic area and has had exposure and has little symptoms and has started developing different diagnoses, as you know, attention problems, memory issues, some headaches that are difficult to control, fatigue, fibromyalgia symptoms, all of which I would be happy to discuss and give you cases and my input on it. So this is how I would be structuring my videos at this time, unless there's a request to cover a topic. That's kind of what I would be doing. Hopefully you found this video helpful and some food for thought for a lot of people, especially with September coming up and new school and kind of new workload for people, so something to consider for everyone. If you like these videos, please subscribe to my YouTube channel or visit my website for more information for a monthly newsletter that I put out for the subscribers. Have a good week.